When taking a patient's pulse, which of the following locations is palpated to measure the heart rate? So something to keep in mind with this question is if you glance at it quickly, you might notice that all of the above or any of the above is an option, meaning that when we look through the choices, we just want to know, is it an option to palpate for a pulse or is it not? That would be different than if we had a question that says, which is the most appropriate option to use for a pulse? That would be different because then when we look at the choices, we would think, okay, all of these could be used for a pulse, maybe some of them could be used for a pulse, but which one will be the best one to pick? As opposed to here, there's an option for all the above, and it's saying which is used to palpate and measure heart rate. Therefore, we just want to know, can it be used to palpate or can it not be? So let's look at the choices. So option A, the radial artery. So the radial artery, can it be used for a pulse or can it not? And it can be. The radial artery is an actual artery. So if you have like the patient's wrist right here, then the area around this landmark, right by the thumb under there, that would be used to check for the pulse, and that could be used for radial artery. So yes, that is a correct option for checking pulse. The carotid artery, that also is another option you could use. So if you have the patient here, when you feel the artery on their neck, either there or there, but not at the same time, because if you do it together, then it can make them pass out. So just check one side or the other. That is an artery that we can use to check for a pulse. So yes, that's correct. And then option C is the brachial artery, and that is used in the arm, and that's typically used for a younger patient, like a baby, and it would be kind of in the bend of the elbow. So yes, that can be used to check for a pulse. So in this question, the answer would be any of the above because they all can be used to measure heart rate. They all are arteries we can use. However, something to keep in mind, if this question was asking which would be the most appropriate option to pick, in that case, you would probably want to focus on the radial artery because the radial artery is the most common. It's easy to access. It's right on their wrist. The carotid might be a little awkward or uncomfortable to go to. And brachial, usually that's not one that you could feel as easily, and that's usually used on a younger child. So for this question, it's saying which of these can be palpated to measure heart rate, and any of the above is an option. And yes, that is true. They all can be used to measure heart rate. But keep in mind, in case you ever get a question, which would be the easiest or most appropriate, in that case of these three, the radial would be the easiest or most appropriate. But for this question, the answer is D, any of the above.